I'm Paula Nutting, your musculoskeletal specialist, and today I'm very, very lucky to have a client, Kevin, here who's come in with a shoulder pathology. So it's been an absolute treat to have someone that I've been able to do some filming. So we're going to have a look at his range in internal rotation through Apley's, and we can see the range that he's got here. It's not too bad. This is not the shoulder that's complaining. Can you do the other one, thanks? And can you see he's got far less capacity to take it through range, and that's stiffer.
Yes, it is.
Yeah, okay. And take it back around him. So there's a couple of muscles through the shoulder that we can be looking at. We can address the pec major, the pec minor. We can look at our rotator cuff. We can look at the tightness through the latissimus dorsi. We've also got the serratus anterior, posterior, and our subscapularis. Interestingly enough, not a lot of people do work with subscapularis, but when they do work with subscapularis, they absolutely murder it, torture it, and it's really uncomfortable and painful. And today I want to try to see if we can give you something that's going to assist without creating that much pain. So I'm going to get you to get onto the table for me. So when we're looking at subscapularis, we've got a couple of actions that we're going to be addressing with it. And today what I'm going to be looking at is particularly doing some low load muscle activation. So we're making the muscle contract at short range and also at long range to see if we can get it to enjoy strength at those two lengths, and then we should be able to get the whole muscle to feel comfortable. So when we're looking at subscap, be mindful that we're looking under the axilla, draping as well as we can. For females and males, always please try to cover breast tissue or wear appropriate crop tops. So we can see the axilla, we've got the scapula here, and if we slide our fingers along and along the rib line, we'll actually drop in behind the anterior part of the scapula and onto the muscles of the subscapularis. Now I would normally do the treatment from this side, but I'm going to hoof around to the other side so you can see what I'm talking about. I'm going to pop the fingers down into that area so I can link in, so I can actually feel the movement when Kevin is doing a contraction. So we know at short range, arm down and across, at short range that subscapularis is going to adduct, so elbow comes in and medially rotate. So that's the position I've got him in. So you're going to gently push in and relax. We're going to do it really gently, so like squeezing a marshmallow, and relax. Keep that going for me. I like to try to get this so that the movement is actually on and off. The muscles have to get that neural connection that says turn on and then relax, turn on and then relax. And I can actually start to feel that my fingers are sliding and gliding down between that space. Can you feel that too?
Yeah.
Yeah. So we're not working very hard. How's that feeling? A bit tender, but...
It is a bit tender still, yeah.
Mm.
I feel more comfortable than before.
Good, okay. So always talk to your clients, have them in a really restful position. Anyone who's got lower back pain, I try to put a pillow under the knees or a bolster under the knees to keep the back flat. Just keeps their torso or trunk in a really comfy position. So that's actually starting to feel quite nice. I normally say about 20 of these. Use your palpation skills as therapists because we're so clever with them, and you'll feel it softening under there. One more for me, Kevin. Great. Now we're going to take that arm into that end range, and as you know with subscapularis, when we're raised, it will draw forward and down. So that's the movement that I'm going to do an isometric contraction with. So we're going to take it up here and again further. And again, I would be working from that side for biomechanical efficiency for me, and pull that arm down and relax. But for you, I want you to be able to see what I'm doing. So that's why I'm over here. And relax. And down. And relax. Just to show you where my fingers are, we're cupping right into here, and I'm actually getting quite deep through here, and relax and push. How's that feeling?
A bit sore still, but...
Yeah. This is a lot less a bit sore still than some of those other horrendous things that we've done in the past. Many of us old therapists out there have been doing big fat pin and pinches and drags up the way through here. So this is quite a lovely way to do it. 2 more. And you can see that arm's actually starting to go further into extension just naturally. Terrific. Okay. We're going to have a look and see if we've got any improved range when he stands up and goes through that aptly scratched position again. So good side first, and back, and the other one. How's it feeling?
Much better.
Yeah. So really simple way to work a little muscle that doesn't really like doing a lot of work. We could then give some scapular stability work to assist in keeping the shoulder in its biomechanical perfect position, and that way that keeps the humerus and the ribs sitting quite squarely where they should be. I'm Paula Nutting, your musculoskeletal specialist.